VC sir, namaskar.
Seminar.
Professor Bukulesha, namaskar.
Namaskar. Namaskar. Good to see you.
Good to see you, sir. Professor Pandit, namaskar.
Namaskar, Ahuja sir.
Sir, Professor Mukuleshwar has joined from Singapore.
Okay, excellent.
Dr. Sanjay Rajhans, namaskar.
Namaskar, sir.
So Dr. Sanjay Rajhans has also joined, sir. And I think the Honorable Vice Chancellor has also joined. Professor Daman Saluja, namaskar.
Namaskar, sir. Namaskar. Professor Bamjai is also there, and many have joined.
Yeah, Professor Bamjai, namaskar.
Namaskar. Namaskar.
हाँ बताओ सर, हमारे यहाँ मिनिस्ट्री ऑफ स्टैटिस्टिक्स में एक स्कीम था डेवलपमेंट प्लान स्कीम था, तो उसका मतलब 12th प्लान चेंज चल रहा है, उसका नाम चेंज करना है।
May I know whether Madam Neeta Chaudhary has joined?
स्कीम अप्रूव्ड है, चेंज करना है नाम। स्कीम अप्रूव्ड है, लेकिन अभी नया ये चीजें बनेगा, तो कंटिन्यूएशन चाहिए, जिसमें हम नाम चेंज करना चाहते हैं। हाँ, तो कंटिन्यूएशन जो अप्रूव करेगा तो नेम चेंज भी अप्रूव कर।
वाइस चांसलर सर, नमस्कार।
नमस्कार नमस्कार।
नहीं, जब अगली, ये तो अब पोस्ट बजट है ना, तो जब आप अगला बजट होगा तब उस समय आप कर करिए।
Please start now.
Our guest of honor, Honorable Prime Minister, Health Minister of Delhi Government, Vice Chancellor.
Palak?
Yes, sir.
Just mute yourself. We've yet to start.
Professor Ahuja, I think we need to tell the participants to mute themselves because there is some audio interruption.
Dr. Ajay, can you mute everybody except the speakers?
Professor Ahuja, you unmute. Ahuja, you unmute, please.
Dr. Ajay, please unmute the speakers. May I know whether Dr.
Yes, sir.
Neeta
Yes,
Chaudhary
sir.
has
I'm doing
joined?
that.
Dr. Neeta Chaudhary. Mr. Girish Krishnamurthy, have you joined, sir?
I'm there.
Oh, thank you, sir. Dr. Ashutosh, we need to check whether Honorable Minister has joined.
Yes, sir. Yes, sir.
Dr. Ahuja, I need to go somewhere.
Sir, we are just waiting for the Honorable guest to start with.
I've got UC chairman waiting for me.
Okay. Sir,
me?
please join, once you are free, please join back.
Okay, I'll do that. Fine.
Ji, sir. Thank you, sir. Thank you, sir. Thank you.
हेलो
हाँ जी, हाँ जी.
हाँ आकाश जी, हम लोग बस वेट कर रहे हैं सर का ही. ठीक है बस जो सर का पहले ही हो रहा है, बस कोई इशू नहीं. ठीक है, सर का और हमारे जो वाइस चांसलर सर का पहले ही रहेगा. ठीक. ओके ओके ओके. सर बस
May I know whether Dr. Neeta Chaudhary has joined?
यस सर, वो बस ज्वाइन हो रही हैं सर. एक सेकंड में सर, एक सेकंड में.
Okay.
There is some issue on her connectivity.
Okay.
Hello.
Yes, ma'am. Good afternoon, ma'am.
Good afternoon. Can you get me now?
Yes, ma'am. Yes, ma'am. Yes.
Thank you, ma'am.
आकाश जी, हम लोग वेट कर रहे हैं, सर का ही वेट कर रहे हैं.
इसका वेट कर रहे भाई.
Good afternoon.
सर ऑनरेबल मिनिस्टर का वेट कर रहे हैं बस.
सत्येंद्र जैन जी का.
हाँ जी.
ठीक है. I'm in a small village in Bihar, so my connectivity is poor.
Sir.
सर बस हो रहा है सर ज्वाइन, 1 सेकंड में सर।
अरे ना चल रहा पंखा ना कौन कौन ओ उसने चलता है जी कोलास चलेगा।
सर ज्वाइन हो गए हैं सर। किस नाम से है? प्रोफेसर आहूजा सर। सर सर
आहूजा साहब अनम्यूट करिए अपने आप को।
सर ये आकाश जी आया नहीं इसमें।
Has the honorable minister joined?
Yes, I can see he has joined. His name is showing up on the participants list.
यस सर, सर ज्वाइन कर गए हैं।
नमस्कार सर। डॉक्टर अजय
नमस्कार जी, नमस्कार
सर को अनम्यूट कर दीजिए।
जी सर अनम्यूट है सर, अभी अनम्यूट है सर।
Ahooja ji, he has replied to your namaskar. Let us start the proceedings.
Okay, Ms. Palak.
Yes.
Yeah,
Our guest
please start.
honor,
Please start.
Sri Satyendra Jain, Honorable Health Minister of Delhi Government, Professor
Yes, let's
P.
start.
Joshi, Acting Vice Chancellor of University of Delhi, Professor K. Pandit, CEO of Institution of Eminence, our distinguished panelist, Professor Mukul Asher, Professor Rameshwarnath Kolbamezai, Dr. Neeta Chaudhary, Dr. Sanjay Kumar Rajhans, Mr. Girish Krishnamurthy, and Honorary Director of Delhi School of Public Policy and Governance, Sri Shakti Sinha, respected teachers, students, and all the participants, a very fine good afternoon to all. Our Honorable Health Minister, Sri Satyendra Jain, is an architect by profession and worked at the Central Public Works Department. He is one of the 7 cabinet ministers in the government of Delhi. The portfolios he holds are health, industries, home, public works department, power, urban development, and transport. Professor P.C. Joshi is acting Vice Chancellor of University of Delhi and also a professor of social anthropology in University of Delhi. He was a delegate of the European Union at the United Nations Framework Climate Change Conference held at Poznan, Poland in 2008. He also received the Indira Priyadarshini Vriksha Mitra National Award and Appreciation Certificate for his research on disaster impacts in Asia and Europe by the Faculty of Public Health, University of Indonesia. I would like to introduce Professor M.K. Pandit sir. He is CEO of Institution of Eminence. He has been Radcliffe and Hardy Fellow of Harvard University and also Distinguished Visiting Professor in National University of Singapore. He holds many positions in the University of Delhi. He is also a member of Scientific and Technical Advisory Group, National Mission on Himalayan Studies, Ministry of Environment, Forest and Climate Change, Government of India. I would request MK Pandit sir to take over and formally welcome our guest of honor, Vice Chancellor and our panelists. Over to you, sir.
Thank you, Palak. Thanks a lot. Good afternoon, everybody. It's my proud pleasure as Eminence to welcome our honorable guest, Shri Satyendra Kumar Jain ji, who is the Honorable Health Minister of Government of NCT of Delhi. I think currently these are the most important people in India and globally. So welcome, sir. We welcome you to this particular event. Thank you for being with us at this point of time. I also welcome. We unfortunately could not have our Chief Guest, Shri Ashwini Kumar Chaubey Sahab, because of some unforeseen circumstances. So we also extend a warm welcome to our Honorable Vice Chancellor, Professor Joshi, because we have currently flower show going on in the University of Delhi, and we have some important people there. So he's busy with them. So he's just stepped out for a couple of moments. I also extend a warm welcome to Professor Mukul Esher, who's at the Lee Kuan Yew School of Public Policy, National University of Singapore, that I call my second home. So welcome, sir. Professor Bamzai, who is a well-known public health policy expert, currently the Honorary Director of Delhi School of Public Health at the University of Delhi under Institution of Eminence, and former Vice Chancellor of Shri Mata Devi Vaishnav University. I extend a warm welcome to Dr. Neeta Chaudhary, who was former Secretary to Government of India and knows a lot about health policy and governance of this particular sector. So thank you, ma'am, for being with us. I also welcome Dr. Sanjay Kumar Rajans, who is Vice Chair, Department of Public Policy, National Research University of Higher School of Economics from Moscow. Thank you, sir, for being with us and taking your time for this event. I extend a warm welcome to Mr. Girish Krishnamurthy. He is the CEO of Tata Medical and Diagnostics. I'm sure that you will have a lot to tell us and our audience today about how we can take it to public. I extend a warm welcome, who is basically the host, Mr. Shakti Sinha, a very renowned public policy expert and a lifetime bureaucrat, Mr. Shakti Sinha, who is the Honorary Director of Delhi School of Public Policy and Governance. I welcome also Professor V.K. Ahuja, Virendra Ahuja Sahab, who is the Joint Director of Delhi School of Public Policy and Governance. It is all because of his and the next one, Dr. Ashutosh Mishra, OSD of the School of Governance and Public Policy. Both of them have worked very hard to get this together. He was telling me yesterday, Dr. Ahuja, that it's very difficult to get people to listen to such, but I think that they have, I see at least 460 participants, which is not a bad thing. So it's a tribute to Dr. Ahuja and Dr. Ashutosh Mishra's hard work. So thank you all, and I welcome you all to this particular event on pandemic COVID-19 and public health policy of India. Just a point, as the head of the Institution of Eminence, I just want to share with you that the idea, the main driver behind this, behind creating such institutions of eminence in the country was that, particularly University of Delhi, though we are a mass education university, we produce a large number of students every year. But beyond that, we wanted now to see that what is our place in the in the comity of in the nations. So we thought that the best way would be that to respond globally to the society at large in terms of working on ideas rather than looking at faculties, departments, and what you have. So we started working on different ideas, and public health and public policy and governance are two such ideas to which there are two dedicated schools under this institution of eminence. So with these words, I hand you over back to Palak and welcome you all to this particular event. Thank you so much.
I would heartily request our guest of honor, Shri Satyendra Jain sir, to take over the virtual mic and address the audience. Thank you, sir.
नमस्कार। जो पब्लिक पॉलिसी के ऊपर हेल्थ जो अभी पेंडेमिक चल रहा है कोविड का, आप लोगों ने जो ये मीटिंग रखी है इसके लिए मैं पहले तो बधाई देता हूँ। जहाँ तक मेरा ये मानना है कि जो कोविड का जो बीमारी आई इस देश के अंदर, इस दुनिया में, तो ये किसी ने इसको देखा नहीं था, सुना भी नहीं था, सोचा भी नहीं था। 1918 102 साल पहले ये बीमारी स्पेनिश फ्लू के नाम से आई थी और किसी के पास कोई एक्सपीरियंस नहीं था इसको कैसे टैकल किया जाए। बिल्कुल अलग अलग तरह की बातें थी, अलग अलग हाइपोथेसिस थी। लोग कह रहे थे कि भाई शायद एकदम से बहुत तेजी से फैलेगा, 1 महीने में 2 महीने में पूरी दुनिया को कवर कर लेगा। कुछ लोगों का कहना था कि नहीं, सर्दियों में रहेगा, गर्मियों में खत्म हो जाएगा, या 32 डिग्री टेम्परेचर के बाद नहीं होगा। तो सारी जितनी भी थ्योरीज थी, थ्योरीज तो फेल हो गई सारी की सारी। और इसको रेस्पॉन्ड कैसे करना है, मुझे लगता है कि इसको जगह लर्निंग बाय डे बाय डे लर्न करके सीखने की कोशिश की गई। और थोड़ा हम लकी रहे कि हमें दूसरों के एक्सपीरियंस से सीखने को मिला। जैसे यूएस के अंदर, यूरोप के अंदर जो हुआ, उससे हमें थोड़ा सा सीखने के लिए मिला और उससे हमारे को रेस्पॉन्ड करने के लिए आसानी रही। जैसे दिल्ली के अंदर हमने एक चीज पॉलिसी के अंदर चेंज किया, मेजर जो चेंज किया, वर्ल्ड ओवर पॉलिसी में कह रहे थे कि जो भी पॉजिटिव केस हैं उसको एडमिट कीजिएगा हॉस्पिटल में। हमने देखा कि इटली के अंदर लोग सड़कों पे थे, हॉस्पिटल के बाहर सड़कों पर थे। तो उसके बाद हमने अपने सिस्टम को चेक किया, तो हमारे यहाँ पॉजिटिव केसेस 1000 थे और सस्पेक्ट 4000 थे। तो हमने कहा अगर 5 गुने लोगों को हम एडमिट करेंगे और एक्सपेक्ट ये कर रहे हैं कि एक दिन में 10,000 केस भी आएंगे, तो 10,000 केस एक दिन में आने का मतलब 50,000 लोगों को हमें एडमिट करना होगा। तो वी हैव टू चेंज द पॉलिसी। और उसको चेंज करके हम लोगों ने होम आइसोलेशन की पॉलिसी बनाई। सीरियस नहीं है, जो लोग ज्यादा क्रिटिकल नहीं है, उनको घर में रखा जाए और उसको मॉनिटरिंग बड़ी रिग्रेस तरीके से की जाए। तो ये पॉलिसी का मेजर चेंज हमने किया था और उसके फ्रूटफुल रिजल्ट भी आए। दिल्ली के अंदर कभी भी ऐसा नहीं हुआ कि बेड्स अवेलेबल ना हो। शुरुआत में छोड़ दिए, जब तक शुरू के टीदिंग प्रॉब्लम थे 1-2 महीने के। उसके बाद हमने एक दिन में 8600 पेशेंट आए थे हमारे दिल्ली में। उस दिन भी हमारे पास 8500 बेड्स खाली थे, जबकि दिल्ली में सिर्फ दिल्ली के लोग इलाज नहीं करा रहे, दिल्ली से कई 100 किलोमीटर दूर से भी लोग इलाज कराने के लिए आ रहे हैं। इसी तरह से हमने जैसे प्लाज्मा थेरेपी को निकाला, तो उसके बारे में बातचीत की। तब तक किसके पास एक्सपीरियंस तो था नहीं, फिर भी हमने ट्राई किया। पल्स ऑक्सीमीटर की बात हुई, तो पल्स ऑक्सीमीटर तब तक हॉस्पिटल के अंदर माना जाता है, हॉस्पिटल में यूज करेंगे। हमने घर घर में बांटे, जितने भी जो भी पॉजिटिव केस आए तो सबको बांटे। तो उससे पब्लिक पॉलिसी को, जो पेंडेमिक के अंदर हम कहेंगे पब्लिक पॉलिसी को लर्निंग बाय डे वाला सिस्टम था। जैसे लॉकडाउन की बात हुई, लॉकडाउन शुरू में किया गया तो सब कह रहे थे कि 3 हफ्ते के लॉकडाउन के बाद ये कोरोना गायब हो जाएगा। कोरोना तो गायब नहीं हुआ, कुछ फर्क नहीं पड़ा और बढ़ भी गया। तो इसके अंदर तो मतलब काफी चीजें अभी भी लर्न करने की है। जहां तक कि जैसे क्वेश्चन था, मैं बार बार जितने भी एक्सपर्ट्स थे उनसे पूछता रहता था कि भाई ये कम्युनिटी स्प्रेड कब होगा। भाई आज कम्युनिटी स्प्रेड जो है, दिल्ली के अंदर सीरो सर्वे में 56% लोग पॉजिटिव आ चुके हैं, परंतु जो हेल्थ एक्सपर्ट्स हैं कम्युनिटी स्प्रेड नहीं मानते। तो मुझे लगता है 100% होना है, उसके बाद मानेंगे कि भी अभी कम्युनिटी स्प्रेड हुआ या नहीं हुआ है। तो इसके अंदर कुछ ना कुछ लगता है ऐसा है कि हेल्थ पॉलिसी से ज्यादा पॉलिटिकल पॉलिसी ज्यादा चल रही है, या कि मतलब कुछ चीजें ऐसी भी चल रही हैं कि जो कि बियॉन्ड हेल्थ है। जो हेल्थ की टेक्स्ट बुक्स में लिखा हुआ है, किसी भी चीज, जब पेंडेमिक डिक्लेयर किया WHO ने, तब तो पूरे दुनिया में बहुत थोड़े से केस थे। अब जितने केसेस पूरी दुनिया में थे उससे ज्यादा एक शहर में है, और उसको भी वो कहते हैं कि नहीं अभी भी कम्युनिटी स्प्रेड नहीं हुआ है। उसको मानने को तैयार नहीं है कि कम्युनिटी स्प्रेड हुआ या नहीं हुआ। तो मुझे लगता है हेल्थ पॉलिसी के अंदर बिल्कुल क्लियर होना चाहिए, उसके अंदर पता होना चाहिए, लोगों को ओपेक नहीं रखना चाहिए। अगर मेरी गलती है तो गलती भी मान लो, ठीक है तो ठीक भी मान लीजिएगा। तो पब्लिक पॉलिसी का सबसे पहला जो टेनेंट है वो है ट्रांसपेरेंसी। जो भी काम कर रहे हैं ट्रांसपेरेंटली होना चाहिए, ओपेक नहीं होना चाहिए, कुछ भी ओपेक नहीं करना चाहिए। उससे लोगों का कॉन्फिडेंस बिल्कुल हिल जाता है, उनको लगता है कि भाई पता नहीं क्या हो रहा है। और उनके अंदर जो भय है, या जो जैसे हम कहते हैं लोगों को इसके अंदर पता लगा कि भाई पेंडेमिक से बचने का सबसे बड़ा साधन है मास्क लगाना। अब लोगों को धीरे धीरे पता लगा कि भाई मास्क लगाना इतना इंपॉर्टेंट है। दिल्ली के अंदर पहले कंप्लायंस बहुत कम थी, हमने इसका जो पेनल्टी 500 रुपए से बढ़ा के 2000 की, तो कंप्लायंस एकदम से बढ़ गई। कंप्लायंस बढ़ने के बाद अचानक केसेस भी बहुत कम हो गए, तो इसका मतलब क्लियर कट था कि पॉलिसी बनाने में इसको मदद मिली। तो ट्रांसपेरेंसी, मुझे लगता है हर चीज के अंदर ट्रांसपेरेंसी होना बहुत ही जरूरत है, और बिना ट्रांसपेरेंसी के कोई भी पब्लिक पॉलिसी पब्लिक हेल्थ के अंदर काम करने वाली नहीं है। जो भी मैं जो एडमिनिस्ट्रेटर्स हैं उनको मानना चाहिए गलती भी हो सकती है। हर आदमी सोचता है कि मेरी गलती होगी तो मैं बताऊं ना, तो गलती है तो उसको एक्सेप्ट कर लेना चाहिए कि हाँ गलती हुई है, बट वी विल रेक्टिफाई इट। और अभी तक तो जो पेंडेमिक को हिंदुस्तान ने जो लड़ा है पूरे दुनिया के मुकाबले में हमने बहुत अच्छी तरह से लड़ा है, और मुझे ऐसा भी लगता है कि शायद अब ये हिंदुस्तान में तो जल्दी ही खत्म हो जाना चाहिए। बाकी देशों का तो इतना कहना मुश्किल है, पर हमारे देश में तो अगले कुछ महीनों के अंदर खत्म हो जाएगा। और मेरा पर्सनली मानना है कि ये पेंडेमिक फेज से खत्म हो गया, एंडेमिक फेज में आ गया है। पेंडेमिक का मतलब ये बहुत तेजी से बढ़ सकता है, एंडेमिक का मतलब चलता तो रहेगा, खत्म तो नहीं होगा, कुछ सालों तक चलेगा। जैसे स्वाइन फ्लू है, H1N1 स्वाइन फ्लू कुछ साल पहले आया था हिंदुस्तान में, तब लगा था कि बहुत ज्यादा है, पर अब ये हर साल केसेस आते रहते हैं, उसके खत्म नहीं हुआ है कभी भी, मुझे लगता है खत्म होने वाला नहीं, हर साल कुछ ना कुछ केस आते रहते हैं। तो उसको भी हमें वी हैव टू लर्न टू लिव विद दिस डिजीज, कोरोना के साथ जीना सीखना पड़ेगा। और इसको मुझे लगता है हमें थोड़ा सा उसी तरह से लेना पड़ेगा कि अब स्टेज क्या है कि कैसे इसका जीना सीखें और इसके साथ हम कैसे जिए, नॉर्मल लाइफ कैसे रखें। एकदम से नी जर्क रिएक्शंस पे अब दोबारा वापस जाने की आवश्यकता मुझे नहीं लगती है। मैं माफी चाहूंगा कि मुझे बहुत अर्जेंटली एक हमारे बोर्ड की मीटिंग है उसमें जाना है, और आप सभी लोगों का मैं धन्यवाद करता हूँ। धन्यवाद, जय हिंद, थैंक यू।
Thank you so much, sir. Now, I would like to invite our Honorary Director of Delhi School of Public Policy and Governance, Shri Shakti Sinha sir, for further proceedings of the moderation. Sir was an IAS from batch 1979. He has edited 7 books and authored 1 book about our former Prime Minister, Atal Bihari Vajpayee. Over to you, sir.
Thank you very much. May I request everybody not speaking to kindly switch off their or put it on mute. In between we hear sound which is very disturbing and not very polite to the speakers. As our Honorable Minister of Delhi government has just told us, exactly where we are, the factual position, accepting our mistakes, from pandemic to epidemic, where are we? These are very complicated issues. And therefore, we decided to hold this seminar to get good opinions. And we are very fortunate today. We have very good speakers. We have Professor Mukul Ashar from Singapore. We have Professor Bamzai, of course, who's very much in the Delhi system. We have Dr. Nita Chaudhary, somebody I know for a very long time. We have Sanjay Rajhans, now in Russia, and we have Girish Krishnamurthy. I would request all our speakers speak about 10-12 minutes each. And I begin by asking Professor Mukul Ashar to begin and give his point of view on the whole thing. Professor Mukul Ashar, over to you.
Hello. Thank you, Mr. Chairman. I'm grateful for this invitation to participate in the webinar. The topic I will speak briefly on, if given 10 minutes, is the leveraging COVID-19 pandemic to enhance public health outcomes in India. We now know that the emphasis of public policies should be on outcomes, and that should be citizen-centric. Lot of time in public policy, the emphasis on activities. इतना मीटिंग हो गया, इसको इतना वैक्सीनेशन दिया, इसको यहाँ मीटिंग किया, and so on. But that is an activity, not an outcome. So a lot of time I have seen in my work in India and with other countries too, that there is a tendency to mix up activities with the outcomes. The COVID-19 pandemic, which is still ongoing, and the healthcare risk or health risk can arise from other sources that we are unaware of, has led to the realization in India that an effective citizen-centric healthcare system involving both public and private sectors and the civil society is essential for not just economic growth, but also national security. So everywhere globally, the public health system or the healthcare systems are now being viewed from these lenses that they could constrain growth, they could adversely affect national security. This has profound implications, this new way of thinking for all the stakeholders. One indication of the newfound importance is that in India's 2021-22 budget speech, perhaps for the first time, perhaps for the first time, the speech lists health as first among the 6 pillars on which the budget is constructed. Now, we all know that health in our constitution is a state subject, but we have a finance minister, union finance minister, starting with health as an important pillar. So there has been a lot of talk about, lot of discussion, whether the health sector should remain with the state or it should be a concurrent activity under India's constitution. And that debate is ongoing. It is worthwhile doing some research on it. While the health is a state subject, many prominent health institutions, such as National Center for Disease Control, National Health System Resources Center, and the Indian Council for Medical Research, currently or have acted more as a resource base for the union government and the states have not made good use of it. So one of the things to get better outcomes is that the states will need to think about not only investing in their own institutions that are appropriate for them. The disease burden in India varies quite significantly across the state, and so does the capabilities. But they will also need to use these national institutions more strategically under the cooperative federalism initiative. So those states that are more willing to work within that initiative are likely to use this pandemic to get better public health, better health outcomes for their citizens than those states that are not willing to do that. It has been very rightly suggested that India has managed the COVID-19 pandemic quite well. And just one statistic on it is that India has got less than 1% of the global active cases, not the total cases, but active cases, because our recovery rate is way beyond the global rate. But in the critical area, that is those who are critically ill, our share in the global is nearly 10%. So in the active cases, it is 1%. That is a fairly good indicator, short indicator, and it would be even better if we can get, if the two states had performed better. One is Maharashtra, and the other is Kerala. So Maharashtra and Kerala in particular will have challenges in trying to review their health institutions to get better outcome. Now, if we look at the systemic, when we look at the healthcare, we need to look at it systematically. Not only the traditional allopathic, but the Ayush ministry that we have, the Ayurvedic, other traditional knowledge systems, which have to be made more scientific and more acceptable, is one of the ways that we can use to strengthen this. Because of our COVID activities, in which we have sent the COVID vaccinations to 47 countries. 39 million of the 47 million vaccines are on a commercial basis, and the rest are on a grant basis. So we have a great deal of goodwill and greater confidence that has been created, which we should take advantage of. We have shown that from a very small or no base, we could become a major producer and exporter of the PPE production for domestic and global markets, as well as in the vaccines. Now, this will have positive effects on our pharma and other related activities. Also, confidence in the Indian medical people. But that confidence has a flip side to it as well. The flip side is that the Indian medical personnel are in great demand globally, whether doctors, nurses, and others. And therefore, we traditionally have not treated our own medical personnel, particularly the student doctors, those who are training, the nurses and others, with due respect and due professional courtesies for the societies. And unless we do that, we will lose the medical personnel abroad. We have been losing, but now it will be even more because of the greater confidence of people. My final point, Mr. Chairman, we have to look at the health system now in a systemic way. There are 4 ways in which we can enhance the public health outcomes. One is to invest. We got to invest in technology. We got to invest in medical training institutions, nurse training, paramedics, all of them. We'll have 23 aims by 2023. And that is a good sign, but we shouldn't look at just the apex, but the lower level as well. The skill sets. And we have not regarded the health system, particularly at the state level, as a professional thing. So we have not developed, for example, databases. We got tremendous databases. If I may say one personal thing, I was a consultant to ESIC. The Director General called me once and said, please tell me how I can improve the ESIC's workings. So I asked, please tell me a simple answer to this simple question. You are saying you got 100 hospitals, 140 hospitals plus in India. Suppose there is a knee surgery, which is standard. What is the cost per unit across your 140 hospitals? He looked at me, he said, sorry, I have no idea. I said, how do you manage? Your priorities are clear. Develop the database, the skill sets, have data analytics people. So how do we recruit the people, whether in public health schools or whether elsewhere is important, knowledge application. A lot of knowledge is outside in the world that we can apply. And the cooperative federalism I mentioned, those states that don't do it are going to find that their citizens, their residents rather, are likely to not benefit. Thank you very much. I hope I am in time.
Thank you, Professor Bashar. Of course, you are in time, even more than in time. And you may not recall, but about 10, 12 years ago, when the Institute of South Asian Studies was at Bukit Timah, I spent 6 months there as a fellow, and I dropped into your room to better understand Indian public finance, pension reforms, to better understand, if you remember the Lalu revolution in railways, how they were able to manipulate, in a good sense, the tariff rate so that railways could generate more revenue. So I'm so glad that even today, in this short time, you give us a very nice bottoms-up building block approach to public policy, rather than looking at grand solutions to try to build up using good data and using good information. So thank you very much, quite a lot for that. It's a pleasure really to listen to you. I'll now move on to our next speaker. Again, somebody whom you look at genetics in India, cancer research in India, Professor Bamza is very much there. I'm an honorary director of the Delhi School of Public Policy. Professor Bamza is honorary director of the Delhi School of Public Health, also an institution of eminence. May I request Professor Bamza to lead us through your perspective on this issue?
Well,
and may I request everybody else, Professor Bamza, 1 minute, may I request everybody else, it is 3 times I heard children's voices. I love children. Possibly this is the wrong moment to hear them. Sorry, over to you.
Thank you, Shakti ji. Very good afternoon to all of you. It was a pleasure to listen to Mukul Esher ji. And coming to my area of work and relating it to public health policies in India, I'll just build a brief background and then come to that specifically. So pandemic COVID-19 provided a unique challenge in recent history. Never before had such a challenge been thrown, where all were exposed to such a threat together world over. There were challenges both for the governments and the public alike, since for the first time the situation tested the ability to muster enough resources and involved daunting logistics. Within our country, even thinking of creating facilities at a required scale for almost more than 1.3 billion was unimaginable. Under this situation, we were subjected to a litmus test for public health policy in India, and we learned a few lessons, and I would come to those lessons one by one. The preventive approach alone made sense in absence of any specific drug available for its cure. In addition, required momentum and motivation were key to keep the medical and essential services operational. Government played a proactive role along with the health and frontline workers. Despite risk to their lives, a majority volunteered to offer their services. Initial glitches in hospital admissions and the fear of high numbers not matching with the existing facilities did create fear and unease. Curbs on free movements and treating the suspected or affected at home met the part of the challenge, with aggressive advertisements and social media connects to spread the word. However, focus was not lost to mitigate the situation with an effective answer in developing vaccine. India, being a vaccine production hub, did attend to this call, not only by producing Oxford AstraZeneca vaccine Covishield by Serum Institute of India, but manufacturing its own Make in India vaccine, Covaxin, by the pharmaceutical company Bharat Biotech Hyderabad, apart from a few more in the pipeline. From the public health policy point of view, the lessons we learned was of the preparedness, and this is very important, in having working vaccine platforms in higher educational or research institutions, especially those dedicated and mandated for such specialty and expertise. Imagine if there was a new pandemic, a new infection coming up, If these vaccination platforms in higher education and research institutions are not ready, obviously you can see the result, what can happen. Engagement of this expertise in a timely and coordinated manner would have enlightened us on the feature of cytokine storm, a cardinal feature in some of the critical patients much before their admission to ICUs. We could have protected their lives had we been having these platforms in institutional settings much before. Expertise in other areas, though not matching with the size of the nation and the scale of the pandemic within the country, was of help to isolate and characterize the coronavirus 2 for genomic variations and mutant populations arising within the country or coming from outside. Presence of such expertise and infrastructural facility, in fact, with more inputs in all tertiary and all secondary level district hospitals and community health centers constituting the healthcare setup in our country, would have been desirable to attend to the scale required for such a pandemic and even for routine purposes. This, I suggest, to be a part of the future public health policy, apart from ensuring presence of bare minimum infrastructure and trained manpower in primary, secondary, and tertiary health services. Well, in a way, we put up a brave face and largely succeeded. Government played a leadership role if we analyze it in retrospectively. Otherwise, the whole healthcare machinery was not so well oiled, barring in urban belts and major cities, which incidentally in the beginning did not show a very encouraging trend as we saw in Delhi and Mumbai and some other cities as well. Although we do have a reasonably large public health infrastructure with more than 24,000 primary health centers and more than 145,000 sub-centers serving 72% of the rural population, but their functional status in terms of physical infrastructure, be it manpower, equipment, drugs, and other logistical supplies to ensure quality services remains in question. Moreover, health research activities have not matched with public health priorities in the past, and we all know about this. However, COVID-19 has changed this. We need to follow this spirit in future as well. Imagine the preparedness reflected in conducting 6,500 real-time PCR tests on March 13, 2020, almost a year back, which on average was not more than 200 tests per state and union territory. This got scaled up to more than 10 to 12 lakhs per day, which on the average works out to 20 to 35,000 tests per day per state and union territory. This was obviously phenomenal, but still not adequate to cover 1.3 billion population of the country. So with COVID-19 experience and the way it has helped the nation to gear up, it's high time that we move on through track developmental model. Now I'm suggesting this two-track development model. There can be many other alternative models of upgrading and upskilling the primary health centers, its sub-centers, community health centers, district hospitals, and tertiary hospitals. Equip these with essentials as proposed in policy documents from time to time. And second, we simultaneously have to catch up with modernization and state-of-art diagnosis and intervention at all levels in all the states. I think Asher Saab has made this comment aptly. A proper description of both viral and host genetic factors that can affect infectivity and disease outcomes will help gauge the importance and scope of a genomics and omics-based approach in the next phase of prevention and control of this pandemic. It attains importance because when age against comorbidities was plotted in COVID-19 cases, when this was done, they put age against the comorbidities, it was observed that there were rare, unexplained resistance to infection in higher age groups and rare idiopathic severe disease in the young. Why would a 40-year-old man who completed a marathon find himself intubated and ventilated for COVID-19 respiratory failure? The current strain of coronavirus with high degree of contagiousness but predominantly asymptomatic or mild illness in majority of the people, it would be highly appropriate to study factors that predispose the host to a more severe form of disease with risk of fatality. We know through our experience within the nation, there are nationwide programs which in the past have been used and they have helped, especially in organizing vaccination drive this time. But we continue to be deficient in diagnostic infrastructure, lab to field translation, and in educating public to adhere to advisories, despite a good number of trained manpower. The vaccination drive now through CGHS supported health system in states and union territories is uncomparable to Ayushman Bharat involving private hospitals and clinics who charge but cover a large population. This raises few queries. In pursuing the policy to reach out to the public for health or healthcare needs, which is not uniform. Besides, integrating traditional wisdom and impact of Ayush, as was pointed out by Asha Saab also, especially Ayurveda, apparently has proved efficacious, which needs to be researched and evaluated after validation for enhancing body's natural defense system and augment immune response as a prophylactic measure. Till now, we somehow managed to overcome the difficult period, though cases continue to be on the rise in some states. Let's not forget that such pandemics are going to be recurrent as the ecosystem and behavior of humans has changed drastically with time. Education, awareness, besides facilitating policy execution at all levels of healthcare infrastructure and countrywide proper database creation, Asha Saab again made this reference to this, are important features of successful delivery of public health services. Delhi School of Public Health is taking some initiatives in this direction. Well, we have to be conscious of now post-COVID morbidities. And what I mentioned about the host susceptibilities, they need to be attended to, which is an ongoing process, not only for COVID-19, but expected future infections and non-infectious diseases to keep the society healthy. And I'm sure that would happen in due course of time. Thank you very much, Shaktiji.
Thank you, Professor Bamzai. You know, as you were talking, I remember that I've unfortunately lost many dear friends in the last 1 year. But one case stuck out. He was my Hindu college basketball captain. Remained really fit, non-smoker, non-drinker, physically fit. Just sent a photograph with this thing on. Yeah, I'm being tested. And the next thing we got was, you're not there. In the sense that, our ability to understand what's happening, the knowledge gaps. And on one hand, as you rightly say, building up from the PhD upwards is very, very important, the structural part of it. The other part of it, why are subgroups more susceptible? Why are subgroups resistant? In the West, the elderly are dying. In India, it is the other way around. I mean, there are knowledge gaps. I'm a layman, but I can sense that the need to really get our public health priorities and our research priorities on one page. I think it's a very, very, I'm so glad you're there. And we hope that we'll cooperate further. For me, public policy is a mission. You are somebody who understands public policy.
Such a small point I want to make, Shaktiji, here.
Please.
Now we have to, since we have lost out on this a lot of time, I think decades and decades of
independence. Right, exactly.
We have to move on two parallel tracks.
Absolutely.
One, modernization, another or basic infrastructure, which is still lacking.
Yes, yes.
And that has to be also attended to. So we have to do this simultaneous exercise.
Yeah. I love the word simultaneous. We think it's one or the other. It's not one or the other. It is both. Yes. It is both. So I think it's a very good point you make. Now, request our next speaker, somebody who I've known for a long time, Dr. Neeta Chaudhary, Secretary, Women and Child Welfare, Government of India, Secretary, Youth, a tough, very tough civil servant. Neeta?
Thank you very much. It's very kind of you to say such nice words about me. I want to focus on one aspect, which is implementation of public policy. We make fantastic policy in India. We ensure that the policy is made in time. And if you just look at our papers, probably they would rate and rank along with anything which is created in the world. But our problem is coming on implementation. I would not like to focus on infrastructure of the health sector, money, this, that, and the other, which has already been said. I only want to focus on how to successfully do the anti-COVID vaccination program at the moment, so that we achieve the purpose of this entire planning which has been done. Fantastic diagnostics, very good testing. We've also ensured the production of vaccines. Now the implementation stage, which we have to focus on. I've been health secretary in UP for quite some time. I've also been Commissioner Muradabad. I would like to take from these two experiences to focus on what is most important. You see, Government of India must have a very well thought out strategy, because of which they have said people 60 and above will be taken up in the first phase. People 45 and above, and those with comorbidities. My problem with this blanket is many people, especially I think at least 50% of UP's diabetic population doesn't know they're diabetic. They've never been diagnosed. And these type of people who are very important to the success of this program, maybe we need to rethink, including in the vaccination program, people who may be in these groups, do not know they are in these groups, but feel sick. Maybe we have to look at the fact that in a village, the most important person to ensure implementation of government schemes is a school headmaster. It is a school teacher. Most people listen to them. They don't listen to us. We used to spend most of our time in the anti-polio drive, the vaccination drive. When we did encephalitis drive in Gorakhpur in 2006 for the first time, we did vaccination of 78 lakh children in 10 days. So the point is, the people who are listened to, who are respected at the level at which we need cooperation, they should now be made part of this program. Rotary India, for example, did a fantastic job. Lions did a fantastic job. And because of them, we could get people to come into our Pulse Polio program. We need not be only age-specific rigid. We need to also look at the influence makers. Maybe what I'm going to tell you will sound a little absurd. A lot of whales were being killed in India, and we didn't know what to do. So we approached one of the very good preachers in Gujarat, and we told him, can you please tell the story of Matsya Avatar in the coastal areas? All the fishing community used to listen to him. So we said, can you please tell these stories over there? And can you please tell them that the whale is actually Matsya Avatar? We succeeded. Can you imagine poor communities for whom the whale was livelihood? It was literally getting food on the table. They did not kill even one whale from 2003 onwards. So we need to have now a campaign in which we get the postman, the village postman. He is a person who has tremendous influence in the village. Now, if we could take these people also, that is the school teachers, the village postman, to be frontline workers and give them vaccination before others, because people ask this question, did you get vaccinated? And if they tell the villagers, look, I'm moving amongst you, I got vaccinated, it's very safe, they will believe them. And what we need now is momentum on vaccination. we can deal with other policy issues simultaneously. But the critical point at this moment is to reach the person for whom the vaccination drive is intended. I would come to a second point in this series. That is, the government has spent so much money. It has spent so much time and effort to show their dedication to the program. But we have a lot of people who still have questions. Let us not treat them all as antagonistic to the government. Let us not treat them as people who are opponents. Let us put forward, I'm so glad you are doing this public policy initiative. I wish you could ask all educational institutions across the country that they must do at least 1 or 2 public policy initiatives like this. We give them a small training program, and after training the trainers, they go forward and train other people. But this must go down absolutely to the bottom level, which is the village school. Starting from the village school, the repetition of this message to all other levels will really percolate fast. At the moment, our lowest level health workers are mostly women. It's a very good thing, but it's also a problem. Because our Anganwadi worker will speak to the mothers. Mothers don't have much say in the village. The say is still with the men. Our health workers, our ashas are also women. Now we face the same problem. Then, sorry to put it quite so bluntly, though we have 50% of the pradhans also who are women. You know, the institution of Pradhanpati prevails. He comes and sits in the meeting and he virtually runs the meeting still, at least for a large portion. So to get rid of this problem, or rather to circumvent this problem, we need to touch upon the lowest level who can convey our message, and it will mostly be the school teachers. So my only request is, all our discussion on other sides can be simultaneous, but at the moment, what we need is implementation. And for implementation, these are some of my suggestions. Thank you very much.
Thank you very much, Hita, for that, bring us down to earth on that point. But I'm not contrary to you. I love the study of Pradhanpatis a few years ago in Bengal and UP, which actually suggested that despite Pradhanpatis, where women were the Pradhan, there was a shift in expenditure. That's a very good sign, but you have a point. The women actually don't have a say. And another point which I really like is the fact that our slotting, 60 plus vulnerable. I think we need to get down to being much more granular and not being so broad about the categorization. I think that's a very, very valid point. And you need to look at the individual, her rights, and therefore how to handle it. I think it's a very valid point. And you complement what has been said, not by repeating it, by bringing a new angle. Our next speaker is Dr. Sanjay Kumar Rajhans, Moscow, higher economics, public policy, how not to get stuck into a Western paradigm of international law, how to bring in Chinese, Russian, Indian perspectives to it, and therefore how to see the world is variegated and not standardized. Dr. Sanjay Rajhans, can I request you now to put your point of view?
Thanks a lot, Honorable Chairman, and the distinguished panelist, and the worthy and absolutely attentive audience. So my point is, to begin with, I'll just read my title. It's about the policy capacity and policy narrative of the Indian government on handling of the COVID-19 crisis. So there are 2 points. One is about the capacity of the Indian state, Indian government, I would say, and the way they have handled the narrative and how they have come up largely unscathed with mounting criticism that they had to handle with. To start with, I would say that on the aspect of competences of the policy capacity, the three competences and skills that affect the ability of government in their relationship with other governance sectors, and that how it manifests are the analytical capacity, managerial capacity, and political capacity. I will try to analyze the Indian government's handling of COVID-19 crisis on those three levels. But first of all, try to go further down the line on those three capacity issues, that these skills and competences are crucial in any policy success, and yet they also rely on the availability of the adequate resources to allow them to be operationalized and mobilized. Because resource capabilities must exist at the individual level that allows individual policy workers, starting from the federal level to the local level, that's what is the first factor which should be taken into account when you are analyzing any government's handling of the crisis, in particular the COVID-19. Then the organizational condition must be relevant to the policy capacity that include information dissemination, then multi-level management, and then political support. And finally, the system level capabilities should be having the trust of the public agencies. So when we try to understand the way the government of India has handled since March 2020 till March 2021, and including the massive contraction of the financial capacity of the state, 3 months of a screeching halt of the Indian economy, the way everything got stuck. And in such a situation, how the capacity of the state was judged by the people at large, both inside India and abroad. So we see it from another public policy theoretical framework, which is called the policy narrative framework. And what one can see here is also some of the key points of the policy narrative framework, which is about the narratives are the lifeblood of politics. And COVID-19 was also a time when politics was at its best and worst in equal measures. So the narrative policy framework starts with the assertion that the power of policy narrative is something worth understanding. It contends that understanding of the policy process on various terrains and multiple junctures are critical for understanding the policy process. These two issues of policy capacity of the state and the way it has handled the crisis of pandemic explains it with two empirical information. First of all, the one data that I would say, as the Honorable Chairman had quoted to infer some of the Western perspective on it. So YouGov Cambridge Globalist Project 2020 had made a survey of more than 25 countries on the issue of the way the citizens of their countries are trusting their government in handling of the COVID crisis. In India, they also took that sample survey. So the primary data was collected of more than 1,000 people. And the data revealed that every 3 out of 4 persons were happily, highly satisfied the way the government of India had handled the COVID-19 crisis. That is first thing. The second point that I would like to bring before you is that it was also mentioned there that India managed to keep the percentage of death at around 1.51% compared to the other South Asian nations with high demographic density. And the same goes with the Southeast Asian countries, in particular cases with Indonesia, Malaysia, and others, which in some countries you also have better living standards and other economic indicators. So the policy capacity of the government of India was to be judged on the basis of several factors, such as high population density, as I mentioned earlier, percentage of people living below the poverty line, with very abject and ramshackle health infrastructure. And also the fact that more than 90% of the people had also recovered once they were affected by the COVID-19. The adroit uses of the traditional health medicine and the government leadership's continuous communication with the masses at various levels had also played a major role in order to underpad and also highlight the different measures that government has taken, and also to supplant some of those lacks and some of those things that the government of India did not have, but by informing, suggesting, assuaging the feelings of the concerned masses on a regular basis, created the narrative of the government's policy on the COVID crisis extremely well. As one might know that the narrative policy framework has those 4 essential elements. What one is setting, when policy making context and socio-economic factors are taken into account. Then you have character, at least you have to have 1 character or 2 characters. You can have a hero and a villain, that means the leadership and the opposition. Then you can have a plot, a common story, where the common story is about the COVID-19 crisis, and also the morale of the story. So these are the 4 basic pillars of the narrative policy framework theory. And on that conceptual framework, one can identify that government of India, despite having lots of opposition parties in different states, could manage to organize regular roundtables, virtual roundtables, and try to engage a circularity of discussion and bringing a consensus of guidelines, that was reached at a consensus level. People came together and they tried to ensure that there is a coherent implementation of the lockdown and post-lockdown period too, the way the gradual unlocking occurred. So the moral of this, the moral is the takeaway, as you say, one of the 4 features of the narrative policy framework, that how would you identify this crisis has been strengthening the state, or strengthening the image of the government, or weakening the image of the government. I would say that on the issue of COVID-19, the Indian government at the federal level tried to transcend the party politics and tried to engage every single state inside the country on an equal footing. And though there were petty trifles and aberrations here and there, the leadership at large maintained a very coherent, all-inclusive agenda in which every citizen of the country felt that the government of India is absolutely concerned about their well-being, about their safety and security. Notwithstanding the fact that the abject and the dismal conditions in many states about the health infrastructure, about which Professor Bamzai had spoken earlier, government of India managed to minimize the damage by engaging and communicating at a regular level. So that capability is not only about the resources, but also about engaging and communicating. And that's where I believe the government of India managed to do way better, because it did not only communicate with the citizens, as one can remember that White House also had everyday press conference on the heydays of COVID-19. But this was a communication among all the equity holders of this issue. The opposition parties, the policy advisory community, the epistemic community, thinkers, journalists, you name it. And that was a very horizontal platform that was being further flattened in order to engage and enhance the deliberative quality of the whole process. So on that note, I would try to conclude with is that the policy capacity of the Indian state and the narrative policy of the Indian state on those 2 issues, the handling of the government of India of the COVID crisis has been outstanding. Thank you very much.
Thank you, Sanjay Rajan. Very, very heartening, not just as an Indian, but the way you manage to break it up into 4 different things and use it. I think very useful to help us understand it. Before I ask the last speaker to make his presentation, I'm just reminded of the years ago, 10 years ago, when I was Additional Chief Secretary and Secretary Finance in Delhi government. And as a result of privatization of electricity, we had surplus money, rare in Indian public finance. We set up many institutions, hospitals, Institute of Liver and Building Sciences, other institutions, engineering institutions. And one thing that struck me was what we lacked in all of these was good professional management skills. You build hospitals where your corridors about 40 feet wide and your professor's classrooms about 40 feet by 40 feet, not required. And I complained to my then Lieutenant Governor Najib Jang, this sir, never confuse a good doctor with being a good manager. So our last speaker, Girish Krishnamurthy, is an MBA, runs a massive medical thing, CEO of Tata Medical Diagnostics, etc. I would want him, if possible, because the rest of our 4 speakers have really covered really amazing amount of knowledge that I have picked up, and I'm sure our young scholars have also picked up. If you could bring in, how do you bring in the best of management skills, in a good sense of the term, with the best of technical, public policy, and other aspects of it? So over to you, Mr. Girish Krishnamurthy.
Thank you. Good afternoon, and I'm honored to be with the eminent participants and delegates and panelists of this public policy discussion. I just wanted to highlight few points. First of all, as we spoke, it is very well covered that we handle pandemic, and as a country, we rise up to the pandemic situation, and especially public health system and policy, which really operated in this disaster, a phenomenal way to come up to this. But the right time right now, because of the last 1 year, when we look at overall as a country, while we handle the pandemic very well, as a bubbling, energy-oriented country trying to become a superpower economically, this pandemic has put us a lot of hurdles in between. Now, as a country, we are limping back and coming back to economy. The public policy today on the COVID-19 scenario, on that respect of bringing back to the economy, is more of a reactive model. So probably I would suggest, as the chairman mentioned about the management angle of the overall health system, while we're coming back to the economy, what I'm seeing, there is not a definitive policy and a method and the way we can execute how we come back to economy. Like, how do we open up our schools? How do we open up our colleges? How do we bring back our factories? And how do we run our airports and railway stations? There are a lot of theoretical explanations and reactive messages and circulars and information is given. But if we need to holistically bring back the economy and grow much more faster than what we lost, probably a deeper thinking on this we need to have. Of course, we were, as a country, called for the duty on the emergency we handled. We were nimble enough to do a lot of things. And the second part which I want to bring it, let's take a step back and look at it. Before pandemic, during pandemic, post-pandemic. If you look at top view about our Indian health system, public health system especially, traditionally we set up our health system which is extremely episodic in nature. Somebody falls sick, they seek healthcare, and we make an assumption of this 1.3 billion population that if somebody is sick, he will find the doctor. The second one, the way we set up the health system, while we have sub-centers, public health centers, community health centers, district hospitals, general hospital, teaching hospitals, part of the gamut of public health system, but we have created a very disjointed care model. despite the best effort of NHM and NHRM and the state health functionaries in last 25-30 years. While we have a focused approach to get a mother and child care up and running, non-communicable diseases up and running, but still it is an absolute disjointed care, and more importantly, it says all the time, care only in the hospital. And also most of the care, when we look at it, which is extremely provider-centric, the way we want to run the health system, the way we have the constraints of the financial constraints and infrastructure constraint and operational constraint, the way we want to fund this overall public health system. A pandemic has taught us to rethink this model. Probably my submission to the audience today, we might need to consider 4 other aspects to this overall health ecosystem what we have created. Probably a network. When I say network, it is not a connecting the hospitals and infrastructure. Can we connect every resources, human resources, on an operation theater level, or a cath lab level, or even a small public health center or a nursing station level? How do we really connect and optimize the resources to manage it? Because that is what we saw, that in our health system, when the pandemic hit us, our resources are not optimized. And the second part which comes in, which is where the management angle, chairman spoke about it on this. See, traditionally last 25-30 years, if you look at healthcare, the most of the innovation happened in healthcare, especially on the science, it always assumes a patient is with a doctor. But we know 2/3 of our countries, or most of the part of our countries, both in public and private health system, the biggest problem is the access. I believe if we get a patient to a doctor, doctor will take care of him. But how do we get a patient to the doctor at the right time and the right doctor? Now, these two, if you put together, the total innovation, if you look at, it all happened very closely there. Whereas our problem is access and the delivery. And pandemic has shown us a lot of innovation has come up, but this is an area where we need to focus. The third part, which is again from the management angle, if you look at it, we did a study on a cancer care. We studied about 1,800 oncologists in the country. We studied about 800 to 850 cardiologists in the country, both in public and private. 52% of their time is spent on non-clinical activity. And absolutely 35% of their time is spent in administrative activity. Is this the right way of using them? Can we bring in technology and other means so that those administrative and management activities and coordination activities somebody can handle, so that we can very quickly swing back and create our infrastructure and the readiness? Now, looking at the other aspect of it, which is the people aspect of it, what pandemic has taught us is we don't have the right set of people available at the right place. This has been a biggest issue, especially in the rural India. Now, pandemic has created a clear-cut mechanism that we need to really look at it. How do we really handle resources, human resources especially? Putting all these things together, the way I'm thinking, what we really need to focus on our policy going forward. One is the pandemic, as Nita madam mentioned about the problem in front of us is the vaccination. But vaccination is a great opportunity, as madam mentions. This is the first time in one short period of time, we are going to touch every Indian to do vaccination. The other only occasion we do in India every 5 years during our election, that too about 60%. Now, this is an opportunity is presented in front of us. Let us not lose this opportunity. This is the time to collect data. This is the time to bring intelligence. It is not a vaccination exercise. It is the future of this country's exercise. As a government policy makers, if you are all able to think through that, let us not lose this opportunity of vaccination. We are not only going to protect our citizens against COVID, but we are going to protect the next 100 years of this country. The way I see healthcare, I don't see healthcare as a service. I don't see healthcare as an activity. I see healthcare as equivalent of national defense. The way we try to protect our border, the way we run the atomic energy institutions of this country, the way we create national assets in our space research program. And if we compare that to healthcare, we are totally dealing with this differently. The time has come. This is a national asset. This is going to protect this country. This is going to define the future of this country. As Tata, we are extremely committed for this kind of model. And from my company, from our group, will always be available for the government to participate however we need to get in. But this way, we see a great opportunities coming up in next 90 days to 180 days. If all of us are buckled up, the way we acted in the month of April, May in 2019, 2020, we have to happen. This will protect this country for next 100 years. Thank you for the opportunity.
Thank you very much, guys. Thank you very much for that. I just recall I was in Tamil Nadu in 1981. MGR was the chief minister, and he had a program called Manurudhi Tittam, which means giving every village. Somebody's mic is on. Can I request to mute the mic? I hear a lot of sounds. Okay. To go back to a story I'm saying, and it meant drinking water, electricity, minimum services to every village. And an officer, my senior in the IS, asked him, "Sir, what about resources?" And he said, MGR said, to his credit, people associate MGR, class 3 pass, kya pata hai usko. And he said, when China attacks you, we'll look around for budgetary support, or we'll just mobilize all your resources. I think Girish has made a very good point in this case. We need to look beyond, get out of this narrow silos, and then look and solve the problem. Now we have 170 participants, 170 plus, 5 outstanding speakers. I have 5 questions per person. I realized that it is not feasible to really open it up to Q&A. Much as I regret it, I would invite all 5 of you. We'll organize separate sessions for you on a specific subject of your choice. Speak to our people. Get grilled by them, because there's so much you told us. There's so much that needs to be questioned, to be interrogated. That will not happen. So unfortunate today, much as we like it, but we've had a very, very rich session. I think in the last 1 hour plus, I've at least gained a lot, and I'm sure our young people have also gained a lot. I'm really grateful that Professor P.C. Joshi is with us, our Pro Vice Chancellor, Acting Vice Chancellor, and his commitment to the Institute of Eminence. In fact, I was about to say that thank you very much, but with his coming and his push, I'll stay on a little longer, only because Delhi University, my alma mater, and of many others, is something which we feel special about and we think can deliver. And with your support, Professor Joshi, and support of Professor Pandit and Maharaj Pandit and others, I think we can make it. May I now request Professor Joshi, Acting Vice Chancellor, to give us his guidance, his suggestions, his advice to us. Magdaji, is Professor Joshi here with us? Dr. Ahuja, Ashutosh.
Sir,
yes, sir, I am calling him.
एक मिनट सर.
If he's busy in some of the university functions, it's all right. We understand the pressure on a Vice Chancellor.
He has logged in, sir. He's very much there.
I'm in a small village in Bihar. So in case my sound goes off, please bear with me.
I think he had some guests, he told us, so I don't know.
Yeah. I think then we can, I must say that in the short run that I've been associated with the Director of Public Policy and Governance, I think to get such 5 good speakers, best part of it, 5 different points of it. Normally we repeat each other. I think we got 5 very good points of view today going. So I think to me at least, this has been, Pandit Sahab, as our CEO, हमारे सरपंच आप हैं, हमारे मुखिया आप हैं.
नहीं, वो पुरानी कहावत है कि that a general is as good as his
soldiers. हम आपके soldiers हैं.
No,
We are your soldiers.
You are generals, I am a soldier.
But I'm so glad. No, you know, people like Professor Mukul Ashar, people like Neeta Chaudhary, people like Sanjay Rajan, Professor Bamzai, Giresh Krishna. I mean, I think I must credit our team for getting a very good panel across, you know. And our young students who've been hearing it, I'm sure that they have gained a lot by it.
Yeah.
Mr. Chairman, thank you so much for this offer that you will ask us to address your students at some other time. In Delhi University, we have many things, but public policy wasn't a subject which we really tackled at all.
Excellent.
So thank you so much for organizing this event. Yeah. It's very timely.
No, we are grateful to you. And as years ago, as a young student of law faculty at Delhi University, young Neeta Chaudhary took a fight with a school, which I not mentioned by name, कि आपने class 1 में security deposit लिया था, मैं class 12 से निकल गई हूँ, give me back. They said, no one ever asked us for the money back. No, you know, as an individual, as a citizen of the country, public policy is about the individual human being, not about us as IAS officers or professors or prime minister. And I think that is the core. As a human being, do I have agency? Do authorities respect that agency or not? And this is our aim at the Delhi School of Public Policy. Absolutely.
Let me, for record, I want to just put it, if I may. I think Professor Ram Singh is with us. Ram, are you there?
Sir, I'm here.
Okay. Wonderful.
Yeah, let me say Professor Ram Singh is our distinguished colleague from Delhi School of Economics.
Absolutely.
And the credit of writing the first background note for this and proposal and taking it to the council, executive and academic council, entirely goes to Professor Ram Singh. I was only playing second fiddle to him. And thank you, Ram, for your,
Can I add a sentence, Professor?
Yes, sir.
Can I add a sentence?
Sure.
In the last issue of Biblio or book review, I can't remember, Ram Singh has an outstanding review of Dheeraj of Deepak Nair's book.
Yes. Did you read that? I read
that. I've circulated it to my entire team. If you want to understand public policy, please read Ram Singh's review of Deepak Nair's book.
Yeah, absolutely. Yes.
So if our VC is not joining us, I think we can ask Professor Ahuja to move on with the vote of thanks, because I think it's been a very rich session. Ahuja
I think Professor Patit would like to say something, sir. Would you like to conclude the session?
I just
half of his for Vice Chancellor, sir. Professor Pandit?
Ji.
Would you like to conclude on behalf of our Vice Chancellor, sir?
Yes, what else can I say except to say thank you, and having heard, some part I missed because we had some guests, but as suggested, that was a very fruitful.
Hello, sir. Vice Chancellor sir has just called. He will join in 5 minutes, he said.
All right. So please let's keep the audience engaged. In fact, since somebody is talking about just now, Sinha Sahab was talking about Professor Deepak Nair. He was our Vice Chancellor, if you may. And anyway, I took over as a professor when he was there. So once we had a conference and somebody was to come, so he was getting delayed or something. Then Professor Nair got up. He said, well, you know what? We are teachers and we are much practiced at the art of speaking. We can engage people as much for as much time as we want. So we have a captive audience, so we can keep them engaged for 5 more minutes. Except just add, because I had not, said in the very beginning, as Ma'am Chaudhary suggested, one of the lacuna that we had possibly at University of Delhi, as we said, that we are a mass scale university, we give mass education, lakhs of students every year. But when this opportunity came at that point of time, only this thing was uppermost in my mind, because it came to me. That time we thought that, we have now moved from these departments, faculties, so let us move to ideas. So what were those ideas that were missing from the academic profile of the University of Delhi? So that time we had already gone on to, make something called, because, for example, Jawaharlal Nehru University has a very good, profile, international profile. They have an international profile because a large number, because of the international school. So we created a Delhi School of Transnational Affairs. So we have a very robust Delhi School of Transnational Affairs, and we will soon start some activity. We have done some activities. A number of ambassadors have come and spoken, and we are doing some work on that. Then this was another idea, that we have a lot of departments who are individually doing their work in silos, as Sinha Saab suggested. So how to integrate them? So therefore, this idea of Delhi School of Public Policy and Governance. So I had initially said governance and public policy, but Ram he said, no, unless there is public policy, there cannot be governance. So he turned it on its head, and the name of the school changed to different. So Ram, can you say something? I would love to hear you, please, because you are a very unique breed of doing economic law, or law and economics. I don't know what you call it. You guys are very complicated. So can you just talk a few words?
Yeah, sure, sir. First of all, thank you for appreciating my contribution when Delhi School of Public Policy and Governance was being conceived, was being planned, was being enacted. I want to make it clear that I put in efforts, but under guidance from you. You were very, very helpful in guiding and clarifying some of the thoughts, and also making sure that logistically it gives us a smoother functioning administration, and also the ideas, the vision of the school. You have indelible imprints on the vision of the school. As to
no, Ram, no, I did not buy either lunch or dinner for you, so you don't need to praise me. Talk about the school. Thank you.
So I think it is a constitutional mandate that we help our society, our government, in designing of public policy. The directive principles of state policy enjoin the government to serve as a welfare state. And a government cannot effectively serve as a welfare state without proper public policy, without proper implementation of public policies. Now, we have a constant refrain that policies are, I can say Honorable Vice Chancellor is here, so let me stop and let's hear Honorable Vice Chancellor.
May I request the Honorable Vice Chancellor to please say a few words?
Okay. Well, first of all, let me welcome. I'll start by welcoming Professor.
I request somebody who has not muted his mic, please mute the mic.
Yes, thank you.
So I would like to, at the outset, congratulate Professor Maharaj K. Pandit, very dynamic CEO of Institute of Eminence. We have got very distinguished panel. Professor V.K. Ahuja is a well-known authority. He's a very well-known legal expert of our university. And I can see Professor Shakti Sinha there. So welcome. You are helping the university a lot. And I don't know whether Honorable Minister Shri Satyendra Kumar ji is there. If he's there or if he has made it, well, I would like to welcome him also. I'm no expert in this area of public health. Only I have worked in the field of traditional medicines. That's the only relation that I have. But I think the topic that is taken up today by this our School of Public Policy and Governance is a very, very important topic, pandemic COVID-19 and public health policy of India. And when we are talking of public health policy of India, I think there is a lot that we need to cheer about. The way India has handled, it has really surprised the entire global community. And we have once again, we have shown that there is something in India, there is something in us which makes us stand apart in the global community. The way we have made progress in fighting COVID, well, there are all kinds of views about why India did not have it in so big numbers, looking at the population count of India. Some people talked about Indians have the natural immunity because of the spices and all those things. I don't know. These are all theoretical ideas. They needed to be pursued. But definitely, India fared quite reasonably well. And I think even the second wave of COVID, which is some people were predicting, are no more there. So I think that is a lot, because Indian public health drive started from the top, right from our Honorable Prime Minister, Sri Narendra Modi ji, who became an example. And in fact, look at him, he was always, you can always see him with mask and following all the protocols of COVID-19. And I think if the leader follows, then we all follow that. And that could have been a reason why this could not had a devastating society as it was predicted, especially I think in the rural areas. And I think the way Indian society, Indian science and technology developed capacities within a very short period of time, with PPE kits, right from PPE kits to RT-PCR capabilities, and coming up with vaccine in time, and now giving not only vaccine in India, but also all over the world. We are actually using it to help many other countries which are not so capable. I think India is coming out with a helping hand. So it is again a kind of an issue to be debated in public policy and governance as well. So I'm very happy that all of you have assembled here. I can see that 138 people are still, linked. So, and you have all luminaries, Professor Mukul Asar, Professor R.K. Bemjai, of course, who doesn't know him, Neeta Chaudhary ji, Sanjay Kumar Rajhans, Girish Krishnamurthy, and of course our Shakti Sinha ji, Vikya Ahuja, Asutosh Mishra are always there. So I only would like to thank you all that you tried to debate this important topic, and definitely with the efforts made by all of you, with your experience, new insight will be generated as far as the public policy aspect of the COVID-19 is concerned. With these words, I thank you all for patiently listening to me. Thank you. Namaskar.
Thank you, Professor Joshi. Thank you very much. Good to have you. I know as a Vice Chancellor, you have 100 things to do, from cutting ribbons to opening flower shows. And I'm not minimizing the pressure on the VC to satisfy the, I can imagine the pressure on you. Before you came, I was mentioning, I'm so glad you are here. Your support is very critical to us. So we look forward to your continued support.
Thank you.
Now request Professor Ahuja, who shoulders the burden of DSPPG, to now give a vote of thanks to Vice Chancellor and everybody else. Ahuja ji.
Thank you, sir. Shri Satyendra Jain ji, Honorable Health Minister, Delhi Government, in absence. Professor P.C. Joshi, Honorable Vice Chancellor, Professor M.K. Pandit, CEO of Institution of Eminence, dear panelists, my colleagues, participants, dear students, a very good afternoon. It is a matter of great satisfaction that India has not only played an excellent role at domestic front to contain COVID-19, but also made its presence felt at international level. I was just listening our Vice Chancellor, sir. He has also pointed out that India is helping the other countries also, and we are doing very well as far as the vaccination part is concerned. India's, of course, not helping the other countries and WHO at the same time by providing vaccines, but it has also raised the issue of waiving intellectual property rights at the TRIPS Council of the WTO. I'll say two lines on that because that has not been touched upon. In fact, India and South Africa has introduced a proposal for TRIPS waiver. Now, TRIPS is basically an agreement on intellectual property rights. And it is all because of the TRIPS agreement that the prices of the patented medicines are very high. And of course, the vaccine price of this COVID-19 is not an exception. So what this proposal of India and South Africa suggested, it said that IPR, intellectual property rights, should be waived, particularly the patent rights, with respect to COVID-19 vaccines and other related medicines on temporary basis. And there should be a free flow of such vaccines throughout the world, as opposed to the concept of vaccine nationalism, which is a problem and which has been adopted by America particularly, and the European countries also. The proposal was introduced last year in the month of October. It found great support from the developing countries and the least developed countries, but unfortunately it was opposed by the worst affected country of the world, America. It was also not supported by the second worst affected country in terms of mortality, that is Brazil. And it was also not supported by many European countries. And as you know that most of these pharmaceutical companies, they come from America and European countries. So they did not want to waive the intellectual property rights because that is the only way that their pharmaceutical companies can mint money, not make money, mint money. And you might have seen the moment, they were given the Pfizer and Moderna were given the green signal by the United States, their share prices went up like anything. So this proposal of India and South Africa to waive the TRIPS agreement obligations, of protecting patents, that is still pending, and it is being discussed. And let us hope that some sort of consensus will arrive at, and there will be some sort of flexibility which will be adopted, and these patent rights will be diluted on the temporary basis as far as the COVID-19 vaccines and other medicines are concerned. It is my proud privilege to thank Honorable Minister of State, Shri Ashwini Kumar Chobe in absentia. Honorable Minister was set to join us, but unfortunately there was some urgency at the last moment and he could not join us. So I thank him in absentia. I'm extremely thankful to Honorable Minister Shri Satyendra Jain ji for gracing the occasion. He was with us, but then he had to leave for a meeting. And these ministers, the health ministers, the minister of Delhi government as well as our central minister, they deserve a big round of applause for handling this pandemic in Delhi and controlling it successfully. So we did very well. And if we see the rate of mortality per million, so I think India is far better than many of the countries. I'm also thankful to our Vice Chancellor, Sir, Professor P.C. Joshi, for gracing the occasion and presiding over the function. And particularly, it is a flower show today. And I'm really sorry that I troubled you, sir. But I'm so thankful to you that you could find some time for us and you graced the occasion. Thank you very much, sir. I'm also thankful to Professor M.K. Pandit and Dr. Ashutosh Bhardwaj. They are basically the two pillars of the Institution of Eminence. Professor Pandit is a guiding force for all of us, and Dr. Bhardwaj is providing all necessary support for the smooth functioning of Delhi School of Public Policy and Governance. I'm thankful to our first panelist, Professor Mukul Asher from National University of Singapore. I requested Professor Asher to associate with us formally and guide us to take the DSPPG to a new height. And he was very kind and he immediately accepted my request. Thank you, sir. We will keep on bothering you in future also. I'm also thankful to the second panelist, Professor R.N.K. Bamejai, who is Honorary Director of Delhi School of Public Health. Is a very well-known name, as a great person, a great speaker. And this is an area, the health policy, which in fact comes under his jurisdiction, I mean, under the jurisdiction of his Delhi School of Public Health. But at the same time, it is the one which is, which comes under our jurisdiction also, as far as the health policies are concerned. I request Professor Bamejai and Professor Daman Saluja, who is the Joint Director of Delhi School of Public Health, to collaborate with us, and will have more programs in future in collaboration on public health. I'm also thankful to our third panelist, Dr. Neeta Chaudhary, the former IAS officer, who was holding very senior position in the government, and she had a very wide experience of policy making in India. And I was really, surprised when Madam said that, well, it is the school teacher, who has a great say. It is the headmaster in the village who has a great say. It is the postman in the village who has a great say. So this is all really good. Thank you, Madam, for taking out time from your busy schedule. Thank you very much for sharing your ideas. I'm also thankful to Dr. Sanjay Rajha, who is presently Vice Chair in the Department of Public Policy, National Research University, Higher School of Economics, Moscow. I request Dr. Rajans to be associated with us in future also, and we can just think of having some programs in collaboration with your university. Thank you very much, sir, for sparing time for our event. I'm also thankful to our panelists from industry, Mr. Girish Krishnamurthy, who is CEO of Tata Medical and Diagnostics. Thanks a lot, sir, for your discussion on health policy from industry perspectives. When we formed this particular panel, so what we did, we took academicians, we took scientists, we took bureaucrats, and we took the industry representative also. So when we talk about public policy, as our already director sir had rightly pointed out, it's about human beings, it's about all, it's about masses, not for any individual or so as such. But then what happens is that you need to know the views of all corners, like what are the views of the industry, what the scientists are thinking about, what the ministers were thinking about, and how the bureaucrats were forming policy and implementing them. As Madam Neeta had rightly pointed out, the implementation is also something which is very challenging. Making public policy is one thing, but then implementation is again something very challenging also. So listening to all of you was really a great experience. And I think in future also, whenever we should have these kind of programs, I'll keep in mind that we have people from diverse background, so that, we can listen to each one of them and we could know the issue from their perspectives. I'm also thankful to our honorary director, Shri Shakti Sinha ji, for moderating the session. He's always with us and he keeps on guiding us. So before starting this program,
I'm a part of you.
Before starting this program, we had a discussion, and Dr. Shakti Sinha had pointed out that let us start a lecture series on various themes of public policy. And he has also, promised me that he will be suggesting some big names and, the people who are renowned in their areas. And of course, we will come out with a lecture series very soon. And I think we'll start it with Professor Mukul Asher. I was just talking to her, and it was like cryptocurrency and blockchain that we thought of. And then there are a lot of themes, where we need to discuss a lot. I'm also thankful to our member of the advisory council, who is now the member of the governing board, Shri Subhash Pandey for being with us. And Subhash Pandey is another person who motivated us all the time. He's one who is writing for us his blogs and occasional papers. Thank you, sir, for being with us. And Professor Ram Singh had already been introduced to you. And let me once again tell you that this particular school, Delhi School of Public Policy, is a brainchild of Professor Ram Singh only. It is a different thing that I am the joint director and Shri Shakti Sinha is the honorary director. It was all because of some reasons, that Professor Ram Singh could not join, and therefore I had to step in. But then, honestly speaking, if the credit goes to someone,
we need Ram Singh.
It is Professor Ram Singh only. Thank you, Professor Ram Singh, for being with us. I'm also thankful to Professor Pinky Sharma, who is the new Dean of the Admissions. She is now looking after the entire admission of the Delhi University. So thank you, Pinky, for being with us. I'm also thankful to my younger colleague, very energetic Dr. Ashutosh Mishra. It is he who had organized this entire event. So the credit of this event goes to Dr. Ashutosh Mishra. I'm thankful to Dr. Ajay Sonavane, who is also providing, always providing us his technical support, and he's managing the whole thing. I'm thankful to all the teachers, friends, particularly my young friend, Miss Palak Arora, who's a member of the student team. She's the one who made this poster, and she's the one who was doing the comparing work also. I'm also thankful to all the student volunteers, all the participants, and everyone who was associated with this program. Thank you very much. Namaskar.
Namaskar. Thank you very much, everybody.
Namaskar.